Please subscribe and hit the bell icon to never miss a video from Acuere Life Science Foundation. Myself, Dr. Shantanu R.Joshi, a clinician, a pharmacologist and a drug researcher. Dear students, today I am going to tell you why aspirin is responsible for development of ulcers in the stomach. What is the mechanism that is responsible for development of ulcer in the stomach? Dear student, do remember aspirin is having the pKa value of 3.5. The acid dissociation constant of aspirin is 3.5 and pH of the stomach is 1.5 to 3. Do remember a very simple thing that the acidic drug, when the drug is acidic and the medium is acidic, the drug will remain in its unionized form. And unionized form of the drug is an absorbable form of the drug, because as the unionization part increases, lipid solubility of the drug increases. And this is how aspirin will be well absorbed in the stomach. Now, how the aspirin will be there in the stomach, in what form? For that, I am going to tell you the dissociation of weak acid. Do remember, whenever a drug is an acidic drug, its ionization can be given by this formula. It is the pKa value of the drug, pH of the medium is equal to log of unionized to ionized drug. Unionized to ionized drug. Now, we are going to tell you very simply, suppose I am having the drug which is 50% ionized and 50% unionized. What will be its effect on the formula? The 50% of the drug is unionized and 50% of the drug is unionized. How it is going to affect? Now 50 divided by 50 is 1, and that's why the equation will be pKa minus pH is equal to log of 1. pKa minus pH is equal to log of 1. Now all of you know log of 1 is 0. Logarithm of 1 is 0. Logarithm of 1 is 0 means pKa minus pH is equal to 0. It means that pKa is equal to pH. In very simple language, 50% of the drug will remain unionized and 50% of the drug will remain ionized when the pKa of the drug and pH of the medium are equal. pKa of the drug and pH of the medium are equal. Now I have given you the example of aspirin. It is having the pKa value of 3.5, means at a pH of 3.5, my point is very important. At the pH of the medium, at the pH of the medium of 3.5, aspirin will remain unionized 50%. Now, this is a very important thing I am going to discuss. pH of my drug is 3.5. Now, medium is also 3.5. If it is there, then 50% of the drug, that is aspirin, will remain unionized. If you are going to reduce it to 2.5, that is the pH of the medium is going to be 2.5, then the unionized component will be 90%. And if you further reduce to 1.5, the unionized component of aspirin will be 99%. All of you know unionized means lipid soluble. It is having very high absorption. Now do remember, the pH of the stomach is in between 1.5 to 3. That is, it ranges in between this. In between this, very simply you can say either it is 90% or 99% of the drug is unionized. That is aspirin in the stomach is in highly unionized form, highly absorbable form. This is the calculation. Now, what is my point? My point is that when the drug, that is aspirin, is in the stomach is having the pH of 1.5 to 3. Drug is highly unionized means lipid soluble, and that's why it will pass to the wall of the stomach. it will pass to the mucosal cell. This is the mucosal cell. It will pass to the mucosal cell very easily because it is in lipid soluble form. But a pH of the cell of the stomach is 7. It's a neutral. And that's why when the highly ionized aspirin will enter the cell, it will become unionized because it is the alkaline medium. In the alkaline medium, the acidic drug remains ionized. This is how aspirin will be highly ionized in this cell. Now, it has to pass to the blood. But a pH of the blood is 7.4. Now, the point is very important. In the cell, it is in its ionized form. When the drug is in the ionized form, it is least lipid soluble. It is highly water soluble. Now, this is the acidic drug and this is the alkaline pH. And that's why the transfer of the drug from this place to this place will be slow. Now, the transfer of aspirin from the cavity of the stomach to the stomach cell is high. But from the stomach cell to the blood is slow. And this is how the drug accumulates in this mucosal cell. Naturally, it's a corrosive product. It is also, it itself is acidic in nature. And this is how aspirin get accumulated in the mucosal cell, will damage the mucosal cell. And this will lead to the development of ulcer there. Now, aspirin there inside the stomach cell in its ionized form. And this is known as iron trapping. This is known as the concept of iron trapping. Why aspirin produces ulcer? In one line, if you want to say, it is because of the iron tapping of aspirin in the mucosal cell. This is how, my dear students, your patient will develop ulcer. And this is the reason, my dear student, why we ask the patient to check his stools for occult blood. Because this happens in the GIT. Minor quantity of the blood may mix with the food. That will pass to the stools. And the stools will have the test of occult blood positive. Whenever the patient is on the aspirin and shows the signs of anemia, that is the point where you have to check his stools. Because of this, minor bleeding will continue with the use of aspirin. The patients of IHD, the post-AMI patient, the post-stroke patient, all are taking this aspirin at 75 milligrams daily. And this may cause these ulcers. And that's why you have to check the stools of that person, if especially the person is showing you the signs of anemia. Thank you, dear students, for being with me for such a long time. Thank you. Dear students, thanks for watching. Please like, share and subscribe.